at the Urban Institute, where his research focuses on evaluations of innovative crime control policies and justice programs. Dr. Roman is working to adapt social impact bonds to public safety reform efforts for the Bureau of Justice Assistance and is evaluating the Juvenile Justice Reform and Reinvestment Initiative for the Office of Juvenile Justice and Delinquency Prevention. He is also directing several studies funded by the National Institute of Justice, including 2 randomized trials of the costs and benefits of using DNA in motor vehicle thefts and burglary investigations. A study investigating why forensic evidence is rarely used by law enforcement to identify unknown offenders, and a study on wrongful conviction. He is the co-editor of Cost-Benefit Analysis and Crime Control and Juvenile Justice Courts and Teen Substance Abuse, and the author of dozens of scholarly articles and book chapters. Dr. Roman is a lecturer at the University of Pennsylvania, an affiliated professor at Georgetown University, and contributes to City Lab and the Huffington Post.
All right, so I'm going to try and be brief because I think we're running late. I wanted to thank Representative Scott for being here today. It's an honor and a privilege. Denny and Neil, thank you very much for putting this together. I think there are 5 or 6 people in this room I've literally emailed dozens, if not hundreds of times that I'm meeting for the first time today, so this is really like homecoming. But before I let you go, I want to say that, so I've been at the Urban Institute since 1997, and my very first task at the Urban Institute was working on a juvenile justice and delinquency prevention funded grant called Safe Futures. And my very first task at the Urban Institute was to summarize Catalano High. And so it's a delight to finally meet you, so catch your plane. And that is actually true. Since we're not in a formal hearing, I wanted to sort of, as we go, sort of point some people out who can be resources to you. Amy Ellsbury, can you give a wave, is the Urban Institute's Director of External Affairs and can link you to anybody at any of the Urban Institute's 10 policy centers, and we study everything on the domestic policy agenda you can think of except the environment, and I'm not sure why we don't study that, but we don't. So anything else? Okay, promoting crime prevention and youth development. Let me just say, I want to go quickly through this stuff because we cover a lot of the ground. I've tried to anticipate things that I thought you guys might not have covered and might disagree with, so we can duke it out a little bit here at the end, okay? So this is really the only thing you really need to see from me. This is my blueprint for effective governance. And I'm going to talk about all these things in like one slide. So if you're thinking about leaving, it's one slide. Okay? Have government by outcomes, not outputs. That is the exact opposite of what we do today. Fix how governments share information. Change who gets juvenile justice system services. Scale effective practice. And I think I disagree with Dr. Catalano maybe a little bit on this one, and we can have a little discussion about that. Measure, implement with fidelity. Document your change. Do all of those things. We do all of those things, but we do one of them at a time. We don't ever do all of those things. So I want to make an argument for doing all of those things. Use innovative finance to fund this, okay? Next slide. Okay. To understand juvenile justice, you must first understand procurement, and you hear procurement and everybody nods off, right? It is literally the most important thing that goes on in this whole process. Governments know what they spend, but they don't know what they buy. And let me just walk through that process, right? Governments, so one thing I want to do today, if I do nothing else, I want to give you 4 or 5 little cliches that you can take with you to help make this case. Governments know what they spend, they don't know what they buy. Okay, so policy is about how dollars are distributed across programs, right? So we decide how many, what is our sentencing policy going to be? How many people are going to put in juvenile corrections? And then we have this pot of money, and then whatever's left over goes to doing other stuff that we'd like to do, right? And so the policy decision drives the distribution of the dollars. Then we find programs, and we say, okay, a program is about who is qualified to deliver a set of services, a portfolio, as was just said. And then the services are what we actually do. And now we've gone so far down the funnel that the places where we're making decisions have nothing to do with the people who are delivering the service, right? So governments contract with programs. The programs then provide a bunch of services, so in effect we are buying outputs, not outcomes. Next slide. Government choose what kind of services they want to deliver based on what? I don't know. I can guess. Stuff they read in the paper, stuff that their advocacy organizations that they trust tell them, stuff that, I don't know. I think it's all well-intentioned. I think people are trying to do things that sounds good, but I don't think most of it is evidence-based. So I think governments and the procurement process itself is a real barrier to doing these things better, because it doesn't allow the private sector and nonprofits and other people with good ideas to bring those ideas to government so government can fund them. It says government must come up with all the good ideas itself, put out a solicitation that the private sector and nonprofits and philanthropy and whomever can respond to. And there are a lot of really smart people in governments, but there are 3,100 counties in America, and not every single one of them has somebody who's qualified to put out one of these solicitations that asks the right question. And there are things the federal government can do to help that process. That is a separate discussion I would be happy to have. So I think, what happens is that governments pre-qualify programs. People go through some process where they demonstrate that they can deliver some suite of services, and then they get a number. And so we have 1,000 kids we need to serve, and so you get 500 of them, you get 250, you get 125, and you get 125. And the mix of services that you deliver is kind of up to you. And what we're going to do is we're going to reconcile at the end of the day how much you spent versus how much we expected you to spend, and we're never going to reconcile at the end of the day whether the quality of those services was what it was supposed to be. Right? Next. Okay. We touched on this, it's worth repeating. Youth with the greatest needs touch multiple sectors. They touch juvenile justice, they touch education, special education, child welfare, and other systems, and these systems are not allowed to communicate with each other. Right? Governments don't share information, and I couldn't figure out if that should say governments don't share information or government doesn't share information, with the idea being that within a government we don't share information and we don't share it across governments, right? And the goal is to protect the privacy of the kids, right? We don't want to tell the education, you're a school that your kid got arrested and got adjudicated delinquent for some sort of criminal offending, because then the school might treat them differently. And so the goal is noble, but what it means is that the neediest kids, families, and schools, and somebody else has already made this point, kids, families, schools, do not have coordinated care. Kids touching multiple systems do not have anybody who's integrating the things that they're getting. And so, I think the word iatrogenic was used, which I have a colleague who uses it all the time, and I always make him define it for me again. So I think it's worth saying, but it's counterproductive, right? So you might be getting one intervention in the school for one set of issues, one intervention in juvenile justice, and another intervention through child welfare, and those things may be in conflict and making it worse, because we cannot coordinate information. The other point I want to make is that adult systems and juvenile justice systems are not allowed to share data about a single individual as you cross the threshold from one system to the other system, and what that means, and all the researchers are going, this is a huge problem, right? And everybody else in the room is like, I don't care. But it's a huge problem because it means that we can't learn about criminal careers. We can't learn about how people progress through systems. We can't learn about whether, the harsher penalties of adult systems are more of a deterrent factor or whether they might not matter at all, right? We can't learn any of these things, so we should learn these things. Next slide, please. Okay. So who is getting a placement? So what's the narrative in the movies, in the newspapers, and on cable television, which is frankly, other than Twitter, where we get all our news. I get all my news from Twitter. But. So who gets a placement? Who is adjudicated delinquent in a juvenile justice system and gets an out-of-home placement in a secure or staff-secure facility? Well, it's a lawless, soulless, hardened gangbanger who isn't afraid to die, right? That's the narrative. That's bulky. David Kennedy, who is a professor at John Jay College of Criminology, has this wonderful quote: even gangbangers look both ways before they cross the street. If they weren't afraid to die, they wouldn't bother, right? So it kind of ruins the narrative. So another way to make this point is, if you go to, so in America today, if you are arrested for a felony as an adult, and a felony being a crime that carries a penalty of a year or more in prison, you are less than 10% of people who are arrested for a felony actually serve a year or more in prison, right? And what that means is the people who go to prisons are the worst of the worst. And yet, what do we do in most of our prisons? We let them walk around and talk to each other and socialize. And they have to solve problems like, there's one TV and what are we going to watch? And they have to figure out, how they respond to the incentives and cues of each other. In fact, we say they can operate within a community. And these are the worst of the worst. It's the 5% of people who actually get incarcerated for a felony. In a society that incarcerates almost nobody for a felony, right? And so the idea that secure placement is the place to start for juveniles doesn't fit any kind of narrative that you can come up with. We tried this in the 1990s. We had this whole narrative about super predators, and there was going to be this demographic explosion of teenagers, and they were going to be, out of control, and society would blow up, and crime would dead. Right? So I think we just need to, changing this narrative, I think, is a really critical place to start. Next slide. So what should we do with juveniles who are adjudicated delinquent? My colleague at the Rayburn House Institute says, secure commitment should be a last resort, not a default. And there are a lot of places in America where it's still a default. We need to do triage and risk assessment. Really quick digression. This is a good one. Come on. Don't walk out now. This is a good one. All right. Sorry. So there's this guy, Doug Marlowe, who's a professor at the University of Pennsylvania, and he also does research for the National Drug Court Institute in Virginia across the river. Super smart guy, psychologist, lawyer, and he tells this wonderful story about how he hurt his back one day, and he went to the hospital, and they triaged him, and they did progressively more invasive things to figure out what was wrong with his back. And when they got to the least invasive thing that worked, they stopped. Then, a few months later, he's out traveling around. He's in a different place, a different city, different part of the country, different time, and he hurts his back again. And he goes to the emergency room, and they go through the exact same triage process. The exact same protocol. What is the least invasive thing we do? And when we get to the least invasive thing we can do that works, we stop. I don't know why we don't do that in juvenile justice. Risk assessment is really important. There are a lot of places where they don't do risk assessment until after somebody has been adjudicated and their placement has been determined, and that is indefensible to me. Why wouldn't we do the risk assessment first and then use that as part of the decision about adjudication and placement? This last quote is mine. And it's an important thing to understand, which is once you get into the juvenile justice system in most places in America, it is extremely hard to get out of it. And this was your point. We do all sorts of well-intentioned things, but there's no reason to think the juvenile justice system is the place to do those things. Next slide. What works in treating criminally involved juveniles? Dan Edwards, Clay Yeager, have worked on both of these, and they can tell you about these things if you're interested in them. Nurse-family partnership, family-based therapy, which we talked about, FFT, MST. There are programs like this that have an exceptionally strong evidence base. But as John Barron, who runs the, I'm going to get this wrong, Coalition for Evidence-Based Policy here in Washington, D.C., he's got a bunch of Nobel laureates on his board, very smart guys. I have heard him say, we don't have an a la carte menu of effective treatments. I think people believe there are more effective treatments than there are out there. There's lots of places to look. A bunch got listed. I tried to list ones that I didn't think would get listed by somebody else. WISIP is Washington State Institute of Public Policy. We talked about that. Camel Collaborative Blueprints, crimesolution.gov, Council for State Governments, National Military Resource Center. Slide. So there are places to go to look, but we shouldn't approach all these questions as if there is this huge set of options that we just can pick and choose willy-nilly from, because it turns out to be really hard to find really effective programs. Okay, now, 2 more slides, I think. So what is the ultimate objective here? I think the ultimate objective here is to try and create evidence-based cultures within governments, where they really care about trying to find things that work. I'm working on a OJJEP funded evaluation, this really interesting program developed by Mark Lipsey at Vanderbilt, which is trying, in essence, to create scorecards to make it easier for local governments to do the things that they should do based on his empirical data. And even in these leadership sites, most of the programs that they operate are not evidence-based. And these are the leadership sites. Most places, most programs aren't evidence-based. And there's the other problem, which is that when we find programs that work, like family functional therapy and MST and nurse-family partnerships, we don't scale them, right? In this country, the most effective programs are in, I did a study of drug courts. Everybody knows drug courts, they're effective. We estimated that less than 3% of adults who go through the adult criminal justice system who are at risk of drug abuse and delinquency get referred to a drug court. And then some researchers at the University of Maryland and RAND repeated our study and said, no, we were wrong, it's actually less than 1%. Right? So whether it's 1% or 3%, it doesn't matter. We are not getting these programs to 20% or 50% or 80%, and we need to think about ways to do that with the things that work. Finally, pay for success. So we've talked about social impact bonds and pay for success. I'm going to skip what pay for success is in the interest of time and just go to the next slide and say why I think it works. So I think the problem is we have a lack of infrastructure in local, county, and state governments. We have a lack of a social service infrastructure, right? We don't have enough service providers who can provide high-quality services. We don't have enough digital infrastructure. I talked about the problem of us not integrating knowledge across systems and within governments and coordinating care, right? We don't have enough human capital. We don't have enough people who can evaluate the evidence in state, county, and local governments and make high-quality decisions about what kind of, about what the evidence says and what they should do. If you use private capital to finance these projects, and whether that's a social impact bond or pay for success or just classic performance measurement or benefits corporations or whatever the next thing we think of it is, people who invest their private capital, whether they're venture capitalists, foundations, investment banks, or whomever, are going to demand that you tell them what the answers to all these questions are. Where's your data coming from? What kind of performance metrics can you collect? Why do you think the program is going to do whatever it does? Why are you promising the profit you're promising? Why are you doing the scale that you're doing? And I don't think state, county, and local governments at this moment can answer any of those questions. And I love the idea of pay for success, social impact bonds, scale finance, benefits corps, all of these ideas, because they force governments to have to articulate the answers to those questions. And even if they never get to the point of having private financing, going through the process of trying to answer the questions is a big reform in itself. So I'll stop there. And I wasn't sure.
Does anybody have any questions for John? Yes.
Yeah, Dr. Roman, you talked about transparency a lot, and I particularly liked a lot of what you were saying, especially as most people, as you said, when going from the juvenile justice system to being an incarcerated adult, obviously the issue that you carry, I looked at.
Yeah.
But is there something lost? There's no doubt that a person should be looked at holistically and they're getting treatment from different places.
Yeah.
That's certainly a good thing to look at in a bigger picture of the individual, but is there something lost when, potentially 5 different people or physicians or, instructors, counselors are making a decision on one person, whether that's, argument between them, too much information out there on this one individual? Is there a problem with it? Is there something else?
I think there's 2 quick answers to that question. One is that, I think my read of Mark Lipsey's work, and you guys, they're the experts. But my read of his work says that, it's the components of what you do that make a difference in the youth's lives. It's not what you call it. It doesn't matter if you brand it cognitive behavioral therapy or, whatever it is. It's what you actually do. And so following evidence-based practices, it strikes me as a really good idea. And I think I heard Dr. Catalano say that, that they didn't see much, they saw some differentiation in the context of where interventions take place, but not a lot of differentiation in terms of how effective the interventions themselves were. The other thing I would say, though, is what gets lost in all of this is that, Governments should be going through a strategic planning process where they start by asking the question, what are the drivers of my costs and populations? Who are the people, places, families, communities, and schools that I deal with over and over? What are not the neighborhood, but what is the block that the cops always go to? And who are they going to see there, and why? And why can't we solve that problem? And who is the guy who just got out of prison and he's in the shelter, he's got a mental health problem, he can't get a job, he's got Medicaid. Why aren't those systems working together to solve that problem? And the kid who's in the juvenile justice system, child welfare, and the education system. It's a really small number of people are really driving all of our costs, and we're not taking seriously the idea of how to try and coordinate care to fix it. Yeah.
Dr. Rubin, my name is Kate Pauling. I'm from New York City, the probation department there. Related to data sharing, do you have examples of like counties or programs that have been able to do the data sharing without impacting the privacy of their clients? Mayor de Blasio created a children's cabinet after there were a few unfortunate deaths of youth. But that's really the main thing, is like we as probation don't want to reveal too much about our clients because, sometimes people have their own things, but we also want to be helpful with our other agencies. So any examples you have of how people do that?
I mean, I think there are other people, you may know, Andy and Casey and JDAI.
Yeah, there's a, if you go to actually the Carter Models for Change website, the Juvenile Law Center wrote an information sharing toolkit that we use at Georgetown, the Center for Juvenile Justice Reform, Shape Coaches program. We have a certificate program for jurisdictions, which you might want to send a delegation from New York City to, on information sharing. So there are lots of ways to share information in a controlled way and guard against dangers.
So where can you find more information on the use of social impact bonds in this context, and are you aware of any places that are actually doing that?
Well, you could go to www.urban.org/social impact bonds. And we have some products there you can look at.
That's it in the published journal?
Yes, no, we published. We had a grant from the Department of Justice to look at how you could use paper success and social impact bonds within a justice system context. And so there's a process. There are, my knowledge, it's a little depends on how you define these things, but there's a social impact bond at Rikers Island in New York City that was funded by Bloomberg and Goldman Sachs. There's a New York State social impact bond that's funded by the Department of Labor in part. There's one in Massachusetts also funded by the Department of Labor. And there's one in Utah and in Salt Lake County that is Goldman Sachs and Pritzker Foundation. And there are a couple of others that maybe meet that. But if you look at England, there's 14 up and running and another 20 in the pipeline, and these things are up and running in the Netherlands and Canada and Israel and Australia. It's a worldwide fad. Yes.
Hi, Lily Shapiro, also from the New York City Department of Probation. So I'm familiar with the social impact bond in Massachusetts and the CDC bond to do the CDC to cognitive behavior of writers. But I'm curious about, as part of a government agency that seeks to be an evidence-based agency, and using risk needs assessment tools and adhering to the risk needs responsivity principle and a variety of other things, how do you see the relationship between social impact bonds and funding for government agencies, given the shrinkage of the pie, to cover our operations costs, to do some of these things, to properly train our own staff in a variety of evidence-based practices? So
there's a whole bunch of different answers to that. My response is to say, the more evidence-based something is, the easier it is to scale, the easier it is to entice private dollars to invest in it, the less profit you're going to have to pay at the end of the day, right? And so to some extent it discourages innovation, and that's a challenge that we're going to have to deal with. But to the extent that you can share information across sectors, great. You can get cheaper deals, more capital up front, more problems solved. Now, I don't see these deals as being something that should replace traditional government activities. I see them as being, so the really quick story is, there's going to be a cop in the corner, at Penn and 7th tonight at midnight doing ad hoc mental health counseling with somebody who's in a crisis, and they might be in a crisis because they have a mental health problem, they might be in a crisis because they have a drug problem, or they're just unhappy with their station in life. And that cop is not trained to provide that social work activity. And so using social impact bonds is a way to create private financing, to create infrastructure, to expand service systems that aren't big enough to handle the needs of the people who need them today is, that's the goal. Having them replace the activities of the cop on the corner or the probation officer, I'm really not advocating for that. Yes,
But my question is in regards to evidence-based. We've heard that a lot going around, but there has been kind of a backlash in terms of like they're really not sure if things that are being labeled as evidence-based, they're more like evidence-informed. So it's kind of like, I guess because the checks and balances aren't there, you have like FFT and MST, but for people that are saying the program is evidence-based, they really aren't. I guess what I'm trying to say, are we really confident when we're going out and we're saying evidence-based, that this is really an evidence-based program that's out there in the community for the youth?
Yeah, let me just say one thing, and then I'm sure you want to say something too. No, okay. Oh. I would just say this. So what a point I wanted to make earlier, okay, I'm getting pushed up. So one is evidence. What does evidence-based mean, right? And there's, in 1998, Congress gave the University of Maryland a bunch of money, and they created the Maryland Scientific Methods Scale. That's sort of been the gold standard in understanding how good a piece of research is. It's limited, but it's helpful. There's a lot of places, crimesolution.gov, lots of places are trying to, Department of Education, have websites that can tell you if something is proven or promising or, whatever it is. But finding an evidence-based program is part of the thing. The other part of the thing is implementing it with fidelity to the model. I think everybody on the panel has used that phrase at some point. And doing performance monitoring that you're actually doing it the way it's supposed to be done. And I think that the big problem that we're having isn't that, we don't scale things that work, and when we do more of stuff that works, we don't do enough of it in partnership with people who know how to make it work well.